thank you. So there's a terrible mismatch in Australia between the number of people on the organ transplant waiting list and the number of organs available for transplant. I think most people who know about organ donation understand that it saves lives. So I'm not going to give you a reason to say yes, because that's it. But people don't tend to understand a lot more beyond that. And I think a lack of understanding, a lack of information breeds misunderstanding. So tonight I'd just like to address some myths around organ and tissue donation and give you a reason to not say no. The Big 10, we'll call them. So myth number 1, people are dying all the time, so I don't need to donate my organs, thousands of others do. Last year in Australia, around 150,000 people died. Less than 400 became organ donors. In order to become an organ donor, you must pass away in an intensive care unit or an emergency department on a ventilator, most commonly of a catastrophic brain injury. Now that could be a massive stroke, it could be a brain hemorrhage, it could be a lack of oxygen to the brain for a prolonged period of time, or a significant head trauma. So these are sudden and unexpected deaths. So 150,000 deaths in Australia, around 75,000 of those occurred in hospital, and less than 1% of those passed away in that manner in which I described. So you can see that every donor does count. Myth number 2, if I register as a donor, they won't try and save my life. Now, picture the scene, it's an accident, side of the road, the ambulance officers arrive, they do their initial assessment, and the next thing they do is rifle through the people's wallets to see if they've got a donor card. Yep, this guy here was generous enough to register, so we won't bother saving him. I mean, it's absurd, but I have heard it more than once, sadly. So if you know ambulance officers, nurses and doctors, you understand that we're in this business to save lives. Organ donation only occurs once everything possible has been done to save the life of the patient. It's only after every treatment has been exhausted, when clinical condition and imaging have shown that the brain is beyond repair, that we even discuss the potential for donation. It's on my licence, so I don't need to worry about telling my family. Your organ donation wishes are no longer on your licence, and they haven't been since about 2005. We have the Australian Organ Donor Register now. It's a national register. The register is a really great tool, and the authorised personnel who have access do check it in every potential organ donation. But the most important thing that you can do is to discuss it with your family. A memorable discussion, not just what you want, but why it's important to you. This conversation might take place tomorrow. It will take place tomorrow, I'm sure, for all of you. But, you know, hopefully it will never touch your lives, and it might be, if it does, in 5 years, 10 years, 30 years' time. So it needs to be a memorable discussion. And you need to know what they want as well, because it could be you who's asked. Do you know if they wanted to be an organ donor? So the family can override a yes on the Australian Organ Donor Register. So that's, again, why this family conversation is really, really important. So have the conversation, find out what they want, tell them what you want, is the take-home message. They wouldn't want my organs. I hear that all the time. You are not too young, too old, or too unhealthy to donate. Clearly, we need functioning organs in order for transplants to be successful, but we look at your age, your medical suitability, your medical history, and your organ function at the time of your death. You've got to remember that the people on the transplant waiting list are living with or dying from little or no organ function. So what you have is far better than what they have. a lot of people get confused about coma and brain death. So when you're in a coma, you're unconscious because you've had an injury to your brain, but there's still some brain function and you may heal, you may recover. Now, brain death is totally different. It is no brain function, no blood flow to the brain, and no possible chance of recovery. 2 appropriately qualified senior medical officers need to do a specific set of tests in order to diagnose brain death. And there has never been a case in Australia and New Zealand where somebody has been diagnosed with brain death that has ever recovered. So you can be confident in the process. My body will be disfigured. People have open casket funerals following donation. There's obviously only one way to get organs out, but that occurs in a sterile operating theatre with highly skilled surgeons doing the procedure. People have viewings after surgery, and the appearance of the body after donation is just like any other deceased patient. It's done with dignity and respect, and it's a unique environment to be in that operating theatre when it occurs. It's against my religion. Well, most of the world's religions support organ and tissue donation as an act of generosity and goodwill to your fellow man. Islamism, Hinduism, Judaism, Christianity, they all support organ and tissue donation. If you have specific questions, you can always talk to your local pastors, and on the Donate Life website you'll see a step-by-step list of all the religions and what their statements are on both donation and transplantation. It'll just make things harder for my family. Donor families are really well supported through the process. They have donation specialists like myself, pastoral care, social work, the clinicians, the doctors and nurses looking after the donor, to support them through the process, to give them as much information as they need to make a decision and as much time as they need to make a decision about donation. We do mementos, we'll take handprints, footprints, locks of hair, play whatever their favourite music was, anything that we can do to help through the process. We have donor family support coordinators who are grief specialist social workers, and they're available to the family for as long as they need, and they provide bereavement counselling, just an ear, somebody to chat to. We give generalised information to the family about what the outcome of the donation is. So a man received a liver, a child received a kidney, so they get feedback on this amazing gift that they bestow. And we have a service of remembrance as well once a year. It's tomorrow actually, 2 p.m, Bohemia House, if anyone wants to come along. And that's an opportunity for transplant recipients and their family to say thank you to donors and donor families. Families are really proud of the gift that their loved one has provided to strangers. As one mum said to me early on in my job, my son just saved 5 people single-handedly, and that's an amazing thing, and it is something that families are very proud of. They'll use my organs for research or let the med students loose on them. Consent for organ donation is only for the donation of organs into the body of a living person for the purpose of transplantation. Families can give separate specific consent if they are happy for research or med student practice to go on, but organ donation consent is for organ donation only. Lastly, the last myth I'd like to dispel is that people only need transplants because they haven't taken care of themselves. Well, each and every one of us in this room are far more likely to one day need a transplant than we ever are of becoming an organ donor. You can be born with a genetic condition, cystic fibrosis, and need a lung transplant one day. You can be a baby born with biliary atresia and immediately need a liver transplant. You can get the flu, it attacks your heart, you end up with cardiomyopathy, and next thing you're on a artificial heart waiting for a new one. You can rupture your liver in a car accident. So it could be you, it could be your spouse, your parent, your child, your neighbour, your cousin's best friend from grade 2. Any of us could end up with organ failure. So, 2014, of the 700 potential organ donors in Australia, a couple probably weren't medically suitable, but we only have a 60% consent rate. There's some room to move there. 378 actual organ donors. But those 378 organ donors provided 1,117 transplants. So that's 1,117 Australians' lives changed, the lives of their families, the lives of their friends, the lives of their communities. They've gone back to work, they've gone on and had children of their own, valuable members of our community. And not that finance is the first and foremost reason, but a significant drain off the health system. You know, we always have to consider those things as well. As at the 1st of May this year, we have 1,696 Australians on the transplant waiting list. Now, that's the people who get on the waiting list. It's really hard to get on a waiting list. We have very strict criteria because there is a lack of organs as a resource, and you can't offer false hope. Of those nearly 1,700 people, about 50 will be children, and 1 a week will die while waiting. Waiting. But not wishing, because they are very aware that a transplant for them means devastation for somebody else. So it's very hard for these people on the transplant waiting list. And it's not just them that gets affected. As I said, you know, if I needed a transplant, I would probably be too sick to work. My husband would have to stop work to take care of me. We would have to relocate to a metropolitan centre where they do transplants while waiting for that buzzer to go off, waiting for that page, drag my kids out of school, maintain 2 households, and just live with the uncertainty of your future. So I think, you know, one of the things that I really want to get across is that the benefits of transplantation are far-reaching. So what can we do? We just need to normalise it. You know, it's part of end-of-life care. We need to talk about it. Nobody likes to talk about death. That's fair enough. But you know what? It's the only thing that we're all assured of. And your family can't uphold your wishes if they don't know what they are. So have a chat in the lounge room, have a chat at dinner, over breakfast, because I can tell you that that is a much less confronting place to have a conversation than in an intensive care waiting room when you've just been given devastating news. This is not the topic you want to be thinking about for the first time at that point. So go on out there, talk about it to your families, tell 10 other people, bust these 10 myths for me. Now that's an idea worth spreading. It's not rocket science, it's just saving lives. Thank you.